February, we talked about the importance of heart health, but that critical conversation doesn't stop after just 1 month.
Sudden cardiac arrest is a condition where the heart suddenly stops beating, and it can happen with little to no warning, even in people with no prior health concerns. And only about 10% of people survive. This morning, we're talking with a woman who beat the odds. This is Cheryl Jordan Winston, who joins us from Minneapolis this morning. Cheryl, good morning to you.
Good morning.
Appreciate you joining us this morning and sharing your story. Talk about your story and the impact that this journey has had on you and your family.
Well, first of all, thank you so much for having me. And just to tell my story, in September of 2020, I collapsed in my bedroom. I had no pulse. And fortunately for me, my husband did CPR on me. The EMTs came and they successfully resuscitated me. And I was actually a patient in the new Medtronic EV-ICD trial.
And you're obviously here with us, so I'm glad your husband was there and he knew CPR. Your story, very compelling, and thank you for sharing it. And we know sudden cardiac arrest comes with little warning, like you probably experienced, but there are still some signs and symptoms. What should people look out for?
Yes, that's really a great question. And in my case, I had no symptoms, but things like shortness of breath, chest pain, dizziness can all be symptoms of a cardiac arrest. Sometimes heart flutters as well can be a symptom as well.
Is there anything that people can do to lower the risk of death from this? And if so, what are those steps that people can take now?
You know, really, first and foremost, I think consulting with your doctor to, see if you have any of the risk factors for having a sudden cardiac arrest. But then also, it's really getting trained in CPR. So CPR is the first line of defense. My husband started CPR within the first 90 seconds. And if he wouldn't have done that, I wouldn't have survived. So it's really important to get trained and really start that as soon as possible.
Good advice. And Cheryl, if you don't mind me asking, since 2020, have you made any, lifestyle adjustments, or was there anything that your doctors advised you to maybe do now that you were not doing before when it comes to your health?
That's a really great question. Before I had my cardiac arrest, I rode my Peloton a lot. I ate a pretty healthy diet. And I really had no symptoms. So for me, there really wasn't anything that I needed to change. But what I will say is, being in good physical shape really helped me recover from it a lot faster. And so that's a big lesson that I had, and it's something that helped me tremendously.
Cheryl, how has your outlook about life changed since going through this?
I love that question. It's really for me making the most of every day and enjoying every day and ensuring that I have the life I want. I was 49 when I had a cardiac arrest. I never thought that that would happen to me. And so it really was something that made me understand that I need to really live to the fullest because you never know what can happen.
Wow, thank you so much, Cheryl. Your story is definitely inspiring, and we appreciate you sharing the tips and the symptoms of cardiac arrest with us.
Thank you so much.
I'm certainly glad in her case that we have a happy ending, because a lot of people are not very lucky.
10%, that
10%,
statistic is, it's scary to hear.
Yeah.
And just to think, she said she was riding her Peloton bike all the time, and she lived a super active and healthy lifestyle. You would never expect something like that to happen. Yeah.
And thinking about her age too, I'm 6 years younger than what she was when she had this, 7 years younger. And just recently, I asked my mom, just within the past couple of weeks, I was like, hey, can you put together a list of which family members have had what in terms of health conditions? And it was kind of jarring seeing the list that she put together, where there's so much heart disease that runs personally in my family. And sort of thinking about that as I've kind of climbed in my 40s, about it had been 15 years, to be frank, since I had had a yearly physical.
Wow.
Just because I'm like, I don't feel any problems, that sort of thing. But it's because of that. It's because of the risk, at least in my family, for health disease or heart disease, that I had one of those physicals just a week or two ago, just because it's important to keep track of that. So, you know, if you don't have that relationship with a doctor, establish one. You know, take that first step of making that appointment just to get things checked out, and go back for updates, because, you know, in her case, that very surprising to have that happen. And thank goodness her husband was there and knew CPR, which is another important thing that all of us should know.
Yeah, get that CPR training. And I'm glad that you asked your mom for that list.
Yeah, it's important.
Reminder to, you know, check on your family's health history too.
Yeah, it's important to have that knowledge.